Hello. Hi, everyone. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Tuesday, February 2nd, here to give you update on the COVID-19 situation, but mostly just to give you just a brief snippet, remind you about the opportunities for COVID vaccination at the health department this week. So with regard to numbers, we added 160 COVID-19 cases in Mobile County yesterday. That brings us to 33,442. We had 16 deaths reported to us yesterday, bringing our number to 629. Now, that doesn't mean that all 16 of those people died yesterday. What it means is that they were reported to us yesterday. Their dates of death go back to December and January. So the state's been working through a backlog of death certificates and checking to see if people who died had been diagnosed with COVID-19 within the month prior to their death, and associating them as a COVID death if that occurred. So we think that backlog will be worked through in just a couple of weeks, and we'll hopefully stop seeing some of these artificial spikes in the number of deaths reported. So again, a total of 629 people who have died with COVID-19. 4,202 hospitalized. That's an increase of 21 yesterday. And then yesterday, hospitalized with COVID-19 popped up a little bit. We added 9 more people hospitalized yesterday. 232 people in the hospital yesterday with COVID-19 diagnosis. So just to give you an update on COVID vaccination at the Mobile County Health Department. So we had a very successful event today. All of the doses that we had available to us were given within a couple of hours. I think the last shots in arms were going by 11 o'clock, and hour later we were out of there. So we thank our staff for pulling off this amazing event, and we are grateful to those who are working with us. We had a lot of people that did not get vaccinated today that showed up and waited patiently, and we know that there is frustration around that. We are sorry that we're not able to vaccinate everyone who is eligible for vaccination, but we are doing our best to get the doses out that have been allotted to us by the federal allocation that comes to the state of Alabama. So, and we will continue to do that. So we have a first dose walk-in vaccination clinic tomorrow at our 8 Mile Health Center. This is one that we just added yesterday. Again, this is a walk-in event at our 8 Mile Health Center. That's at 4009 St. Stephen's Road in 8 Mile. It'll be tomorrow between 9 and 2 p.m. And like I said, the number of doses will be limited. We don't have a lot of doses available, but we'll give as many as we can tomorrow to those that meet the eligibility requirement. The next drive-through event is Thursday. This is also a first dose event, drive-through vaccination event at Family Health in Citronelle. So this is the MCHD Family Health Clinic in Citronelle. That is at 19250 North Mobile Street in Citronelle. That is also 9 to 2. Drive-through, first come, first served. We'll give as many doses as we have available. Then a first dose drive-through event on Saturday at our North Mobile location. It's not going to be at our clinic location. It will be at the Bellsaw Middle School at 1650 Gartman Circle in Mount Vernon. And again, that's our North Mobile clinic that is hosting that event Friday, drive-through, first come, first serve, until we're out of doses. But just to remind you...
That's Saturday.
Saturday
in Mount Vernon.
Mount Vernon. Saturday, Mount Vernon. Bellsaw Middle School, 1650 Gartman Circle. So just to remind you that you can get this information by calling our telephone line, 251-410-MCHD, where you can hear a recording of this information, or you can go on our website at mchdcares.com. And in addition to the street address and the times and the dates, there are maps online that will show you how the traffic will flow on those days. So please take a look at those maps so that if you do decide to queue for vaccination, that you're getting in the right line on the right direction. So we're really excited for these 3 more events this week sponsored by the health department. And again, all first come, first served, and we will give as many doses as we have available to us. Just to remind you a little bit about a couple other things. Remember, if you have received another vaccine within the last 2 weeks, you should defer vaccination, so we can't vaccinate you if you've received another vaccine in the past 2 weeks. If you have been treated with COVID in the past 90 days by receiving monoclonal antibodies or convalescent plasma, then we cannot vaccinate you. If you have tested positive for COVID, or if you are being monitored for, following a COVID exposure, stay at home. You must continue to isolate or quarantine, and we don't want you coming to get vaccinated. And again, we just have a limited supply, and so we're giving it out. No appointment necessary, but it's first come, first serve until all of our doses have been administered for the day. Remember that the eligibility has expanded to healthcare workers, first responders, people age 65 or older, and then a long list of essential workers, which you also can see on our website or hear on our recording to see if you are eligible. Bring documentation of eligibility, maybe a work badge, your driver's license, a business card, something of that nature. So a couple of questions today, very quickly. Someone from the media noting that the city of Mobile and maybe other cities are planning for a Mardi Gras celebration, and asking me about about precautions and what advice we can give people who might venture to go downtown on Mardi Gras Day. And again, outdoor events are better. That is better than being indoors or being in a confined space, but you still must maintain a 6-foot distance between you and anyone who does not live with you. You need to wear a mask that covers your nose and your chin. You need to keep that mask on all the time. You need to take some hand sanitizer in your pocket or in your bag so that you can sanitize your hands frequently. Things like barriers and doors and dividers where high touch areas are prone to, lots of folks with dirty hands touching them. So do all of those. Stay at home if you're sick. Cover your face with a cloth mask. Wash your hands. Stay 6 feet away from anyone who does not live in the same home as you are. All right. Someone asking about complaints about people getting vaccinated who maybe did not fit the eligibility group, but fabricated or didn't tell the truth or jumped in line. We have heard some of these stories. Some of that has happened at our clinics as well. We for the overwhelming majority of people are following the rules, and vaccinators are trying to enforce the rules. But as you can imagine, as the eligibility expands, it's going to be more and more difficult to prove that someone meets the eligibility or not. So we do hear about those things happening when this is going on statewide. Let's see. Another question about, sorry, just reading these for the first time. That's probably not a good thing. All right, someone asking about expanding the eligibility, that that the state is reducing the age, but they are not including people less than 65 with underlying medical conditions. And we noticed that as well when the state made its recommendation. And I expect that as the vaccine supply continues to grow, that you will see an expansion to people who have underlying medical conditions eventually. Again, just because we had expansion to the current eligibility doesn't mean that we got a bunch more vaccine. Alabama as a state is still receiving only 50 to 60,000 doses a week. But again, we're trying to, follow the eligibility requirements that are, being decided at the state level. And as soon as they decide to open it up to people with underlying health conditions, then we will do that as well. So I think that's all for today. I don't expect we'll add any more new clinics this week since we have one already scheduled for Wednesday, Thursday, and Saturday. But we look forward to seeing you there if you decide to come, and we'll talk again tomorrow and let you know if anything's changed. So thanks, guys, and have a great day.